My name is Dana Evans. I'm a registered respiratory therapist, and I'm the Director of Respiratory Care at Ann and Robert H. Lurie Children's Hospital of Chicago, right here in downtown Chicago. I'm a graduate of MU's RT program from back in 2001, so I've been doing this about 19, almost 20 years. Lurie Children's Hospital is a 364-bed freestanding academic pediatric medical center. We're a centralized RT department, meaning that all of the respiratory therapists that work at Lurie Children's on the inpatient side report up through me, and we provide services everywhere throughout the building for inpatient care, including the emergency department. Respiratory therapists have been front and center for this global pandemic and have been very intricately involved, not only in the care of these patients, but in the planning and preparation for the work that's to come. We're very fortunate at Lurie Children's. We have the ability to test every single patient that walks in the door, and we do. And then upon admission, those kids that do test positive, it changes the way that we interact with them, right? So they're still children, we still treat them like children, but we do it with a lot of personal protective equipment. We've changed the way we deliver inhaled medications. We do less nebulizer therapy and more meter dose inhaler therapy. It's these very small things that actually are quite huge when you think about cross-contamination from a respiratory viral illness that's spread by droplet or aerosol particles. Probably the biggest procedures that we've seen with dramatic changes are around intubation and extubation. So putting in the breathing tube and taking out the breathing tube. Those are probably two of the most risky procedures in terms of aerosol generation, and that really puts the entire multidisciplinary care team at risk. Of course, everyone wears an N95, a face shield, the gown, the glove, the full PPE, but we also are using intubation boxes or intubation tarps. We work hand in hand with the nursing team. I have always considered RT and RN as kind of a right-hand, left-hand situation, working collaboratively to provide a holistic approach to care for those kids. And with our physicians and advanced practice providers as well. We have pharmacists and radiologists. Really every discipline in the hospital, I would say, is a huge part of that multidisciplinary care team in terms of what the child sees. When we're providing care, particularly to a COVID patient, we do multidisciplinary rounds every single day. We talk about not only the care of the child, but are we doing the right things from an infection prevention standpoint? As a respiratory therapist, I've certainly been to MRI a million times, but there are things that they're going to think of that I'm not because that's their specialty, not mine. And I think that's really the key piece here when we talk about interprofessional education or multidisciplinary rounds is recognizing that my team is the expert in respiratory care, and the nurses are the expert in nursing, and the physicians are the expert in their discipline, et cetera. And when we come together, we're really bringing our different perspectives to ensure that we are coming up with the best plan or the best solution for this kid based on this whole team of experts in their discipline. This idea of managing through change and crisis leadership has not only been important, it's been absolutely vital. And that also can't be done in a silo. We talk a lot about multidisciplinary care for the patient. I actually think to be a strong leadership team as an organization, that has to be a multidisciplinary team as well. And I strongly believe as a leader that clear, consistent communication is necessary to have trust. And in a situation like this, trust and leadership cannot be undervalued, because if my team doesn't trust the message that I'm giving, it can be really scary for them and create undue burden, undue fear, undue anxiety. I think the other thing that was really key and is super key when we talk about crisis leadership is empathy for your team. These incredible people that come into this building every day have so much going on, both in the building and at home, and trying to help them navigate that in a way that makes sense while also making sure our kids got great care. You can't know everything, and no one expects you to know everything, which is why reliance on a multidisciplinary team is so important. I believe strongly that we learn so much from each other if we only take the moment to ask And I realize that takes a little bit of humility and willingness to learn. But I think if you try to work in a silo, it's really only to your detriment and then to your patient's detriment. So you want to be as strong as you can as a clinician. And the way to do that is to learn from those around you.